too much blood flow there, too much energy there. The other thing is that these people will predict the worst all the time. And so it can be a sunny day and they are concerned about the storm that's coming, you know, in an hour. So they, you will see that as well. And the other thing that happens, the basal ganglia can get fired up if there's a lot of pain in the body. And so it'll start this pain loop where the anxiety and the pain, you know, start looping together, where you get afraid of the pain and then you have more anxiety and then you have more pain and then you have more anxiety. And so if that's happening, just pain anywhere in the body, you want to take a look at what's going on in the brain. Like what is happening? How is the brain processing the pain? And are you getting into a cycle that you've got to break? So, and if the basal ganglia is too low, then those are the people that are going to get into trouble because they're not able to see what is coming down the pike. They're thinking it's not going to happen to them. And so those are the ones that end up, you know, those are the juvenile, you know, kids that have problems because they're not able to see what is happening. I mean, it doesn't have to be any age. But those are the people who are more likely to be arrested because they're thinking, I'm not going to get caught. I don't have anxiety about that. They have more risky behavior. So these are the people who are parachuting and rock climbing and, you know, motorcycle driving and, you know, all of that they actually need that in order to feel any type of movement and motivation. So those are the ones that have more risky behavior. They can have if the anxiety, so what they're doing with that risky behavior is they're actually trying to treat the low basal ganglia. It's their medicine. They're trying to, they're looking for some motivation and movement. And so they're like, okay, I'm going to go jump off a cliff and see how that feels. And I'm going to drive a motorcycle and see how that feels. And I'm going to go up this, you know, steep climb and everything. So these are the ones, they tend to have lower heart rate when their basal ganglia is too low, and they may not sweat as much. And so they will always think that tomorrow, they'll always put things off until tomorrow when their basal ganglia is too low. So I just wanted to touch base on that because a lot of people, when we think of anxiety, we go to the other end of thinking about, you know, panic attacks and that kind of thing, and increased heart rate and sweating and, you know, all of that. So, so what do we do? What do we do if the basal ganglia is too high and that so if you just even take a moment to kind of feel into how your body runs, like what is your personal idol in terms of inside your body? Does it feel like it runs a little too high? Does it feel calm? Does it feel too calm where you're just kind of like not even moving, laying on the bed? You know, so if that feels off balance to you, then we want to take a look at your basal ganglia. And so how do we treat it? So if it's too high, what do you think, Fallon?
Yoga is huge because it's mindful and it's involving the healthy movements. Super, super important.
Yes.
Definitely just music that you find relaxing can be helpful. That's why a lot of people that do yoga involve music because it can help that just process a little bit better. Especially with temporal lobe, because that is, you know, the area of the brain that can be healed with music. So if you're doing yoga or a guided meditation, you're really hitting a few different areas of the brain and making them better. I think is really cool. And we don't have guided yoga on Brain Fit Life, but there is guided music on there if you have a routine that you're in the know and you don't really need a guided yoga stretcher person. But those are really, really important. And then definitely killing the ants, killing the automatic negative thoughts, doing that cognitive behavioral work is really important.
And so Brain Fit for Life is what?
It's our online forum that has a bunch of brain games. It has guided meditation, has music on there that's clinically shown to help with different things like memory, focus. Also has some on there for just general anxiety, but that also there's a guided hypnosis on there. And for a lot of my coaching clients I was working with who were doing everything that the doctor told them based on their SPECT scan results, but they were still having trouble sleeping, I said, I really want you to try the hypnosis for sleep every night for 7 days and tell me how you do. And not one patient that has done that said they didn't have much better sleep after that.
Yeah. So when you have difficulty falling asleep, typically the basal ganglia is going, your brain's going, and you can't shut it off. You're processing every conversation. If the basal ganglia is too high, and like we said earlier, you may be sensitive to criticism. And so you are replaying every single conversation, every look that person gave you, every, eye twitch, every tone of voice change, all of that. And you are processing it. And so, it's good to be reflective, but if it feels like it's taking over your life, then you want to do something to help calm the basal ganglia. And so another thing that, so the Brain Fit for Life, that's an app on the phone, and you can also get it on the computer.
Yes. I recommend signing up on a computer first because it has a bunch of assessments on there for cognition and then overall brain health. And I think it's easier to do on a computer than a board.
On a bigger, yeah. And so can you, look at your anxiety? Can you look at your basal ganglia? And it'll assess if that is too high or too low.
Yeah, it asks questions that just seem like normal brain health questions, but like everything that we do, it's based on brain systems, not symptom clusters. Yes, we want to know if you're having depression, anxiety symptoms, but we need to know what part of the brain that's coming from based on our assessments. So someone that is predicting the worst, sensitive to criticism, but also is very frequently misinterpreting comments as negative when they weren't meant to be. For example, I really love the shirt you're wearing today. Do you not like any of the shirts I ever wear any of the other days? That is meaning that there's temporal issues as well as basal ganglia issues. And you definitely need to treat them simultaneously, which thankfully most of the supplements that are good for the basal ganglia, most of the exercises that are good for that area are also good for the temporal lobe. And if you're having temporal lobe issues, which most of us at least have some deficits there, just a matter of how bad the symptoms are, the most important thing to treat before anything else.
Yeah, absolutely. And we will talk really specifically about temporal lobes next session.
Yeah. That's a fun, I think it's fun. It's intense. You kind of have to, just talk about it in a good way because it is where our dark thoughts are and all that stuff. But again, it's just, It gives people hope. You get in a car accident, all of a sudden you're having thoughts of wanting to hurt your family that has nothing to do with anything. And it's because of the car accident, because you damaged your temporal lobes.
Right.
We'll
because
next time.
So yeah, we will definitely, definitely want to talk about that. So with the basal ganglia, another really important, that has really helped me is been meditation. And so I tried all sorts of different meditations. I tried different ones online. I tried different, I tried guided imagery with music. I tried just different ones. For me personally, what works the best is a transcendental meditation that I learned. And so I do that 20 minutes twice a day. And what's awesome about that is now I can drop into it pretty quickly, and I can tell during the day if I'm going into more of a fight or flight type of energy. And so when I do that, I just go back to my mantra that I was, that we work with Transcendental, and I can calm my nervous system back down. And the other thing that's helpful is in the middle of the night, if I wake up in the middle of the night, I'll going back into the meditation so that I can go back to sleep. So I think meditation is one of that and yoga to me and hypnosis are like the top three, amazing tools that I think all of us need, especially right now in this time and space.
Yes. I mean, if you go to PubMed and just punch in meditation brain, gratitude brain, there's so many articles of how helpful it is.
Yeah.
And I thought it was really cool that the Scientific American magazine did a huge study on it several years ago. That was super cool. One of our affiliate groups out of Brazil, they come over every year or every other year, and they get rescanned during like the normal scan at concentration. And then they do another scan after meditating to see how it looks different, but also comparing it to the scan they had 2 years before, which because it shows, yes, their brain is getting better, but they're on a whole nother level of healing, right? Like they want to see what areas of your brain are, functioning better during a meditative state, which I just think is like the coolest thing ever.
Well, and it lasts. So it's not just you being, calm in those 20 minutes, but then, it brings your idle down, and then you stay calmer all the way during the day. And you may go up a little bit, but when you do it, that's why they call it a meditation practice. Like it's something that needs to be done every day. It's not a, take a pill and call me in the morning kind of thing. Like, so, but there are supplements, there are good supplements to help temper, to help with the basal ganglia, and doing that along with yoga, meditation, hypnosis, I think is really, really important. So, and just exercise in general. That's anytime you're moving your muscles, you're changing your brain. So that's really helpful. Let's see. So if it's, one of the things that I think about, if it's too low, if there's like apathy, if you have ADD type symptoms with lack of motivation, I think one of the things that you also want to check from a holistic standpoint is to check to see what your cortisol level is doing during the day. So a lot of times I have teenage clients who have their cortisol doesn't get released. And then it looks like apathy, laziness, which is never laziness, but that's what people outside will look in and judge and criticize that person is lazy. And that's not what it is. There's either something going on in their brain with their basal ganglia, or there's something going on with the cortisol level, and the cortisol is not getting released. And so, working with a functional medicine doc can be really helpful for that as well. So one of the best things when people are low on motivation, which is a tough thing to do, because if they're low, one of the best things you can do is when they get up first thing in the morning is to do 5 minutes of cardio. And so there's like a 5 minute, you can go on YouTube and just say 5 minute cardio, and it'll just get your heart rate going, and it'll release the cortisol, and it'll kind of shock your system, it'll get you going. And that's not part of your exercise regime. That's just to get you going. So that is a much better thing to do than to rely on caffeine. So I know we as Americans like to rely on the caffeine. So.
Yeah, I say this a lot to pretty much anybody that's like, if you could give me like any advice about my kid that's hyper versus my kid that is just unmotivated. And the same thing is exercise. Kid, I'm like all about the trampoline, like 5 minutes on the trampoline, and in the morning, 5 minutes before their next session with school lessons. But it's going to be the exact same thing to the brain and the body that kid needs versus the kid that's unmotivated. It's still going to be able to help them. Yes. So that's really important, because and I don't know what the label is, just because I like the H in my ADHD. And there are parents that sometimes get defensive and upset that like ADD is no longer a diagnosis. You can only have ADHD or ADHD inattentive now. because of the DSM changing, which they love to change. So I think sometimes they're like, oh, my kid just has ADD because they're kind of unmotivated, versus having a kid that's really, really kind of bouncing off the walls. There's a very high chance their brain is going to look the same way and need the exact same things. So just drop the label and just see how they do. If you're going to do anything, get them off sugar, get them a trampoline, tell us how they do.
Right. What's going on in the brain, and see. And so, as much as I've educated parents, I find, there's a resistance sometimes, and there's just that judgment and criticism. And that's true for our society of, like, oh, well, they must be ADD. And it's like, their brain just works differently. So how do you support a brain that works differently, and what's going on in their brain, and then work with their brain? So don't sit and judge and, call names and, everything else. I never, ever, but my daughter, who had a lot of brain issues because of post-traumatic stress, a lot of learning issues because of PTSD, she, people around her, her tutors, her teachers, would say to me quietly that she was lazy. And I'm like, she's not lazy. Like, that's not who she is. I know kids who aren't motivated and things like that. And she was motivated. She wanted to learn, but she couldn't because of what was going on in her brain. So doing the brainhealthassessment.com, is that the right, that's really helpful. Because with anxiety in general, there's also there's 6 different types of anxiety, 7 if you include with the combination of depression.
Right.
So anxiety for one person is not the same as anxiety for another person. And so that's really important to figure out what is going on so that it can be treated appropriately. Like, not all, people who are diagnosed with anxiety should get the same supplements or medications. It really needs to, like you were talking about, look at the entire brain system, and not even that one system, but how everything is interacting, amidst the entire brain.
Yeah, especially if you're on a medication that is not a good fit for you, but that level of normal is better than your normal. This is very common in people that are taking benzos. So Klonopin, clonazepam, those types of things, Ativan, they're calming your brain down. But if there's areas of your brain that are already too calm, that's not going to be helpful long term, even though you're just doing the best you can, because that's all that the doctor is really giving you as an option, when there are a lot of other things. And there's so many articles about long-term benzo use and how high they increase your risks for Alzheimer's. And just of all of the scans, like, I'm always hopeful, like, if you're taking the wrong stuff, that it's very quick to fix. It's very quick for us to figure out what you need. But getting off benzos and getting off SSRIs is very challenging. And it really needs to be to a science exactly what you need based on the scan, based on the genetic testing, so that we're not playing with your brain. We're not throwing, darts in the dark at the most important organ that controls your life.
Right.
Are prescribed things like that and you're not responding well, definitely consider talking to one of our doctors, because they can figure out what's going on.
Absolutely. And there was, and I would also say, I'm going to make a plug for Mother's Intuition, because, for what was going on with my daughter, she was not able to retain information. And so she had no short-term memory. And then, of course, nothing was getting stored into long-term memory, because nothing was in short-term memory to begin with. And she didn't have any anxiety. Like, I was getting anxious for her, and I didn't have anxiety in the beginning, but when, after 13 years of watching her operate in the world, I was getting anxiety because she didn't have any. Her basal ganglia was completely, there was no blood flow in that area. So the thing is that, psychiatrists along the way and counselors and teachers were all like, she needs to be on a stimulant. She needs to be on a stimulant. She needs to be on a stimulant. And there was something in my gut that was like, oh my God, no. And I don't know why, but I can say, no, that doesn't feel appropriate. And when we took a look at her brain scan, thank God I listened to my intuition for 13 years and had to fight the system and everybody in it. Because she, out of her brain systems, 4 of them were hyperactive and 1 was not active enough, was hypoactive. The basal ganglia was not. And so if we had put in a stimulant there, it would have set her brain on fire. And I asked, it was such a relief to see her scan, because I asked the doctor and said, what would happen if I had said yes to the doctors who wanted to put her on a stimulant? And he said, she probably could have gone into self-harm, cutting, or harming somebody else. This was like the sweetest girl in the world. And I was like, oh my God, I am so glad that I listened to my intuition. And so I would just like to say, you as parent or guardian, or in that child's life for a reason, if there is something that doesn't feel right, you keep searching and looking. But I mean, really getting a scan, I think, to figure out what's going on in somebody's brain, I think is just so vitally helpful. That's why I'm here doing what I'm doing, because my daughter suffered for 13 years and not one person, not one therapist, not one doctor, not one psychiatrist. And I'm an acupuncturist. So then there was a litany of, another probably 10 different types of energy workers and all of that. And nobody in 13 years, nobody said, let's take a look at her brain. And that's when I heard Dr. Amen, he was doing a commercial on Facebook or something. And I, said treatment for ADD. I'm like, okay, we'll take a look at it again, whatever. And the first thing he says is, how can you treat an organ that you don't see? And I was like, yes, that is the missing piece that I have been like, okay. Yes, I'm going to figure out, I'm going to go get her scan. I'm going to drive her 4 hours. I'm going to go get her scan. I'm going to put it on a credit card and I'll figure it out, because it was just necessary. And thank God I followed that intuition, because that has changed everything. So my daughter was probably not going to graduate high school. She was failing out of high school. She was right before she became a junior, we took her in to get her brain scanned, and she graduated 2 years. She brought up to a 4.0. I mean, she just, and now she's in nursing school. Her brain works beautifully. And she's actually tutoring other kids, which is just flooring me, because she knows what it's like to not understand. So, I can't speak enough for getting checked out. And, if your brain doesn't make sense or something doesn't feel right, if your idol doesn't feel right, take a look, talk to a brain health coach. They're on the Amen Clinic's website. You can look at the brain health coach near you, or they can do it virtually. And if you want to learn even more, I think Amen University that's where I took my brain health coaching certification. Just an awesome, it has compressed Dr. Amen's amazing knowledge and research that he has done over 30 years and has given it to us as practitioners and as parents, and for those who are suffering in any way with how their brain functions. It's an amazing, you all do amazing work in the world.
You do too. And I'm so glad that we get to do this. It's just still shocking and happy that we get to do that. Yay. Well, I'm excited for next week. Temporal lobes is my favorite to talk about.
All right. So we'll talk about the temporal lobes. And if you don't know anything about the temporal lobes, We will put some information out, so keep an eye out for our Facebook post, and we'll be back at 11 a.m. Eastern time next Tuesday.
Yes, and I'm gonna post an image of a busy brain with Erlin, and then a busy brain with Erlin just with the glasses, so that you guys can see what we're talking about
See the difference.
the basal ganglia.
Yeah, that would be awesome. Yeah.
Yay!
All right, well, good to be with you, Fallon.
You too, Whitney.
Take care.